Vitamin D deficiency is very common in individuals who have cardiovascular disease, especially those individuals who suffer from heart failure. Researchers now recognize the fact that low vitamin D levels is a predictor for diseases of the heart and blood vessels, including heart attacks and strokes. A study reported in the January 2013 issue of the Journal of Clinical Endocrinology and Metabolism revealed that low levels of vitamin D were associated with an increased risk of having a heart attack, especially in women. Women who had the highest levels of vitamin D had a 68% lower risk of having a heart attack than those women with the lowest levels. Men with the highest levels of vitamin D were shown to have a 44% lower risk of heart attacks than their counterparts that had the lowest levels. Another study showed that the risk of having clogged coronary arteries, which is the precursor of having a heart attack, is more than double in those individuals who have a vitamin D deficiency. Why does vitamin D have such a dramatic effect on the #1 killer disease throughout the world? It is because the heart muscle, blood vessels, and circulatory systems are rich in these vitamin D receptors, which means they depend heavily on vitamin D in order to function at their optimal level. Vitamin D is critical in helping to prevent inflammation, the plaque buildup, and stiffening in your artery and blood vessels. One study found that supplementing with 3,000 IU of vitamin D significantly decreased tumor necrosis factor alpha, which is a major marker of inflammation that contributes to the hardening of your arteries. Vitamin D supplementation has also been shown to actually relax blood vessels, decrease this blood vessel stiffness, improve blood pressure, and improve blood flow. It is becoming clearer and clearer that maintaining optimal levels of vitamin D in your body is critical for a healthy cardiovascular system. However, it is very important to appreciate how much vitamin D your body needs to sustain these optimal levels of vitamin D. The RDA of vitamin D is only 200 to 400 IUs daily. However, the studies that I have referred to in this medical minute supplemented their patients somewhere between 2,000 and 4,000 IU daily. These researchers were just trying to reach a minimum target of a vitamin D level of 30 nanograms per ml in your blood. However, I personally like to see this blood level over 50 nanograms per ml and ideally over 60. In order to achieve these blood levels, it is very important to be supplementing your diet with 2,000 to 4,000 IU of vitamin D3 daily. This is the most potent form of vitamin D. Once you begin to appreciate the significant health benefits you can receive by supplementing your diet at this level of vitamin D3, everyone will make an effort to be sure that their supplements contain these higher levels of vitamin D3.